Welcome to our channel. Today we're diving into an important topic, the treatment of vaginal prolapse. You know me, I'm all about helping you understand your body, and that includes those sometimes uncomfortable or embarrassing issues. We're going to break down the silence around vaginal prolapse and arm you with knowledge. Vaginal prolapse occurs when things move a little more than they should down there. Imagine the muscles and tissues that hold your pelvic organs, your bladder, uterus, and rectum, are like a hammock. When that hammock weakens or stretches, these organs can press against the vaginal wall, and sometimes even protrude out. It's more common than you think, especially after childbirth or menopause. Stay tuned to learn about the various types of prolapse and the treatment options that can help you feel like yourself again. Let's start with cystocele, which is a fancy way of saying the bladder has decided it wants to get closer to the vagina. Picture this. Your bladder, instead of staying put, starts to droop down towards the vaginal wall. Now, this can happen for a few reasons. Childbirth, especially vaginal deliveries, can put a lot of stress on those pelvic floor muscles, kind of like stretching out a rubber band too far. Age is another factor because as we get older, those tissues naturally lose some of their elasticity. When collagen levels decline, things can get a little lax. But don't worry, we'll talk about solutions later. Next up, we have recticele, which is when the rectum, your trusty waste disposal unit, decides it wants to cozy up to the vagina. Imagine the wall between your rectum and vagina is like a thin sheet. In a recticele, that sheet weakens, allowing the rectum to bulge into the vagina. Childbirth can be a culprit here, as can chronic constipation and straining. Aging and collagen loss can play a role too. Now, let's talk about uterine prolapse, which is when the uterus, the powerhouse of the female reproductive system, decides it wants a front row seat to everything going on in the vagina. In this case, the uterus descends from its normal position down into the vaginal canal. Childbirth is a common reason for this. Other factors like heavy lifting, chronic coughing, and even genetics can also contribute to uterine prolapse. But remember, just because it's common doesn't mean you have to live with it. Enterocele, when your small intestine craves the spotlight. Let's move on to enterocele, which is when the small intestine, the workhorse of your digestive system, decides it wants in on the action and pushes into the vaginal space. This type of prolapse is often associated with hysterectomy, where the uterus is removed. Imagine removing a supporting beam from a structure. It can sometimes cause shifts and changes in the surrounding areas. We'll talk about ways to strengthen those pelvic floor muscles and keep everything in its rightful place. Vaginal vault prolapse, when the top caves in. Last but not least, we have vaginal vault prolapse, which is when the upper portion of the vagina, after a hysterectomy, decides it wants to turn inwards. It's like the ceiling of a tent collapsing, the support structure is gone, and things start to sag. This type of prolapse can be particularly challenging because it often occurs after a woman has already undergone a significant surgery. But just like with any other type of prolapse, there are solutions available. Chapter 6. Non-surgical lifesavers. Giving your body a helping hand. There are plenty of non-surgical options that can provide relief and improve your quality of life. One of the first lines of defense is lifestyle changes. Incorporating pelvic floor exercises, also known as Kegels, into your daily routine can make a world of difference. Another helpful tool is a pessary, a removable device that's inserted into the vagina to provide support to the prolapsed organs. Now, in some cases, non-surgical treatments may not be enough, and that's okay. Surgery is always an option. There are different surgical techniques available, and the best option for you will depend on the type and severity of your prolapse. One common procedure is called a colporrhaphy, which involves repairing the weakened vaginal wall. Another option is a sacrocolpopexy, which is a more involved procedure that uses mesh to support the prolapsed organs. You're providing that extra support to keep things lifted and in place. Dealing with prolapse can be physically and emotionally challenging, and it's important to remember that you're not alone. One helpful resource is physical therapy. A pelvic floor physical therapist can teach you exercises and techniques to strengthen your pelvic floor muscles, improve bladder control, and reduce pain and discomfort. Another valuable resource is behavioral therapy. A therapist can help you identify and manage any stress, anxiety, or depression that may be contributing to your symptoms. So, you've undergone treatment for prolapse, congratulations. But the journey doesn't end there. Just like with any other health condition, post-treatment care is crucial for ensuring a smooth recovery and preventing recurrence. If you've had surgery, your doctor will give you specific instructions on how to care for your incisions, manage pain, and gradually return to your normal activities. And whether you've had surgery or not, maintaining a healthy lifestyle is key for preventing prolapse from rearing its ugly head again. That means continuing those pelvic floor exercises, maintaining a healthy weight, and avoiding activities that put excessive strain on your pelvic floor muscles. Ladies, it's crucial to be in tune with your bodies and recognize when something's not quite right. If you experience a sensation of heaviness or bulging in your vagina, it's like your body's waving a red flag. Don't ignore it. Difficulty urinating or defecating is another telltale sign that something's amiss. And if you experience pain or discomfort during sexual activity, don't suffer in silence. Your health and well-being are paramount. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Proper management and treatment can significantly improve your quality of life. We've covered a lot of ground today, from the different types of prolapse to the various treatment options available. But the most important takeaway is this: you are not alone. Prolapse is a common condition, and there's no shame in seeking help. Stay healthy and take care.